everyone, my name is Lemenseh and I'm applying for the nursing program in fall of 2020. How I chose nursing as a major is a little bit of a roundabout story. So after high school, I was very involved in sports and I thought I wanted to be a physical therapist, so I attended UW-La Crosse. After a couple of years there, I switched my major a little bit for more of a fitness emphasis and decided I wanted to do personal training. I ended up graduating with a major in exercise and sports science, emphasis on fitness, and a minor in Spanish in August of 2018. Since then, the real world hasn't really been what I thought it was going to be. While I attended UW-La Crosse, I was a CNA at a Alzheimer's and Dementia Assisted Living 12-bed CBRF. I did that for about 2.5 years, and I really enjoyed the job. I loved the new challenges every day. I liked the relationships I got to have with the residents, even if they didn't always know who I was or they created a different image of who I was. It was a very satisfying and rewarding position. That turns out is what I've been looking for throughout my life and for my career choice. After I graduated, I thought I was going to feel that same rewarding, caring feeling that I had when I was a CNA as a personal trainer. After about 1.5 years in the field, I realized that is not true. I do not personally experience those feelings, which is what I'm really looking for in my career. I always reminisced back to when I was a CNA and how fulfilling it was, how every day was new, was challenging. There were some great times, some sad times. It was just some of everything, and that was awesome. That's really what I was looking for. So I am now trying to go back to school to become a nurse. So moving on to describe a time in my life that was difficult, but I persevered. There were lots of times in college, but seeing as how I have successfully graduated with my bachelor's, I would like to talk about something a little more recent. In July of 2019, we found out that my grandma had lung cancer. There was some miscommunication through the family, and we didn't quite know how bad it was. We didn't really know too much at this point, except that we needed hospice, so it was pretty severe. And everybody was taking shifts so that she never had to be alone because my grandma lived alone. So during that time, I took the better part of a week off and I went and stayed with her. This brought back a lot of emotions from my CNA days, a lot of those old habits that I would do, and really just caring for people, getting to show them how you care and just trying to make them happy and comfortable. It was a great feeling to feel again, and something that I was looking for in personal training that I was not getting, that I started to feel again when I was caring for my grandma. So during those times, they were pretty challenging at points because it was very different than when you work as a CNA. You don't normally have those emotional, personal relationships right off the bat with your residents, but with my grandma, I did. So it was very difficult to see her take turns for the worst or to struggle with things that she never struggled with before, to almost not be my grandma at times. During this time, I developed a very important trait and skill on being able to really tuck away what I want and what I am feeling. During these times when she was struggling, she didn't need sympathy. She didn't need me crying or feeling upset, even though that's what I felt. She needed somebody to be hopeful and be like, oh, that's okay, don't worry about it. Reassuring. She really needed just somebody to be there for her and put her needs first. And that's what I did during that week. I believe that this is a awesome skill to have in a healthcare worker of any kind. That's all I would really ask for in a nurse. My grandma did have hospice nurses stop by, and they did exactly that. They were rocks for us. They were there for our needs and my grandma's needs. They didn't worry about themselves or what necessarily they were feeling or what type of burden we were putting on them by allowing us to talk to them about our feelings and our experiences. My grandma ended up passing in September of 2019, so it was about 2 months that we did in-home care with hospice. And hospice kind of guided us through the whole situation on what to expect. Every time she hit like a new milestone, what we could expect, what was going to be happening to her, what the next steps were, how we were going to continue to move forward. They were just absolutely amazing. They really helped hold the whole family together during this stressful time. And I really want to be that person for someone else. I want to be that rock. I want to help take some of that emotional burden and really just be there for the family and the patient or resident in what they need during these times, because that's who it's all about. I believe I'm a very caring and empathetic person. I don't really enjoy sympathy. I do enjoy relating to others' experiences, though, and I believe that helps me build a little more of an intimate relationship with patients, so that they can feel more comfortable coming to me and telling me anything or asking questions. I really want to keep an open relationship at all times. I believe that already having my bachelor's degree is going to be an incentive moving forward into this program. I learned lots of study tips through college, and I'm more determined than ever to get this degree. My job experience gives me a very good outlook onto what nursing is going to be like for me after college. I feel very confident that this is the career choice for me. Well, thank you all for listening, and I hope you have a great day. Bye.